Give us a big smile, Brainiacs. Why, you ask? Because today you're going to the dentist. Oh, wait, sorry. No, you're not going to the dentist. Brainerd is. Say hi, Brainerd. You see, Brainerd hasn't been looking after his teeth, but like a lot of people, he's also terrified of dental procedures. After all, you'd have to be a little crazy to enjoy drills and spiky tools poking around in your mouth, all while a dentist tells you to open wide while asking you a series of now impossible to answer questions about your day. Unfortunately, this fear and anxiety behind dental procedures can become a sort of self-fulfilling prophecy. By avoiding simple procedures like cleanings, you can allow minor problems to develop into much bigger ones, like tooth loss, dental infections, or even oral cancer. Yikes. So that's why today we are forcing Brainerd to go to the dentist. It really is for his own good, we promise. But although we can drag Brainerd to the dental office and strap him into the operating chair, we can't really force him to relax or convince him to unclench his mouth. After all, he's nervous and afraid, and the pain he thinks he's about to experience isn't going to do anything to make those feelings go away. Fortunately for us, there's a wonder drug that can. You've probably heard of it before. It's called laughing gas. But how is this innocent-sounding anesthetic capable of eradicating the pain of someone literally yanking the teeth out of your mouth? And could it really be the solution to Brainerd's crippling fear of dental work? Guess we're going to find out. Laughing gas, also known by the chemical name of N2O or nitrous oxide, neither of which, to be honest, are nearly as catchy. This innocuous little chemical was first discovered by English scientist Joseph Priestley way back in 1793 and is still being commonly used in medical procedures over 200 years later. It's colorless, odorless, and overall surprisingly nondescript for a chemical with such a cool name. But seriously, what were you expecting? A rainbow-colored gas that smells like sunshine and cotton candy? Okay, that would be amazing. But yeah, laughing gas is not that. Although N2O may look very cool or smell very cool or even sound very cool, its effects are, in fact, quite groovy. Breathing in nitrous oxide has a profoundly calming effect on the mind and body, giving patients like Brainerd a relaxing and euphoric feeling that can result in giddiness and laughing fits, hence the name laughing gas. These powerful feelings of tranquility and euphoria, coupled with the drug's fast-acting nature, make it an effective and reliable sedative for dental work. Even the most terrified and worrisome patients can find themselves laughing at their own cowardice just moments after taking a dose of N2O. Since it's a gas, nitrous oxide is administered primarily through inhalation, typically through a mask that sits on the patient's nose. As the patient, or in this case Brainerd, continues to breathe normally, the gas will find its way into the lungs, and from there into the bloodstream. Shortly after, Brainerd will experience a floaty feeling and maybe even some tingling in the tips of his fingers and toes, a sign that the sedative is working. At this point, although Brainerd will still be conscious, he'll be adequately sedated enough for surgery to begin. Now, although laughing gas does have the pain-killing properties, it's not 100% effective, which may be concerning to hear if, like Brainerd, you're someone who's about to have your teeth drilled out of your face. Luckily, dentists are aware of this and typically pair the gas with a local anesthetic that will numb the mouth itself so that you don't feel any pain at all. Laughing gas's biggest contribution to the dental procedure is really bringing the patient from a place of pain, fear, and anxiety to a more floaty and happy place where they can chill out and let the dental professionals do their job. I know what you're thinking. A drug this cool must have some terrible side effects, right? So tell us, Brainiac, what is it? Is it making your fingernails fall off or making your breath stink, your skin turn gray? Go on, just spill the beans. I'll be honest with you. There are a couple of potential side effects like fever, wheezing, and hives. However, the vast majority of people don't experience any adverse effects at all. And even if you do, they'll wear off shortly after you remove the mask from your nose, as the oxygen in the air quickly displaces the N2O from your system. It is, however, possible to overdose on laughing gas, and that is no laughing matter. Too much of it at once can result in seizures, choking, psychosis, cardiac arrest, and more. However, it is worth noting that to OD on N2O requires way more gas than your local dentist should be using. The nitrous oxide your dentist will give you should be mixed with oxygen and balanced to levels that are safe for the human body. Considering the drastic difference between this and pure N2O, it should be pretty difficult to make such a fatal mistake. So, compared to most sedatives and medications, nitrous oxide is remarkably chill. In fact, it's so chill that you can even drive yourself home after your surgery. Of course, you need to wait until after you're fully alert and free from its effects, so it should be like 15 minutes tops from the moment you stop breathing it. Of course, a good barometer of how dangerous a chemical may be is whether or not you give it to children. After all, if it's safe enough for a tiny version of you, the big version should be fine, right? Well, you may be pleased to learn that laughing gas is actually the preferred method of sedation for children. Like we said, its effects aren't that serious and wear off rather quickly, so there's really no danger involved. The only people who probably shouldn't use laughing gas as an anesthetic are people with respiratory problems like emphysema, bronchitis, and cystic fibrosis. But that's just common sense. If you have trouble breathing in oxygen, you probably shouldn't be breathing in any other foreign gas. So, since laughing gas is basically a wonder drug, you shouldn't need any other anesthetics, at least not for a dental visit. But if you are someone with a respiratory problem, or if you just like going against the grain for some reason, there are a couple of popular alternatives available. You've probably already heard of oral sedation like Valium, Halcion, and Xanax. This group of drugs are known as benzodiazepines. Try saying that 3 times fast. And they work by slowing down parts of your brain that make you feel fear and anxiety, giving you the calm and relaxed demeanor healthcare professionals are looking for. However, benzodiazepines don't work as fast as you may like, so you need to take them like an hour in advance. Plus, everyone's different, so you don't really know when they're gonna kick in. On top of that, since they're so unpredictable and take so long to have an effect, it makes it more difficult to adjust an incorrect dose on the fly, which means you can potentially find yourself horrifically under-sedated for an operation. Yeah, ouch. On top of that, if you take these pills, you'll either need a cab to your appointment or get a friend to drive you, since benzos leave you feeling groggy and out of it, meaning you'll be in no condition to operate a vehicle. If you're not a pill person, some of us still have trouble swallowing pills, and that's okay. Don't worry, you still have options for safe sedation, provided you're okay with needles, that is. Intravenous sedation, also called IV sedation, involves sticking a thin needle into one of the many veins in your arm or hand and directly pumping a liquid sedative into your bloodstream. The benefit of this method is that it's so direct you won't be sitting around all day twiddling your thumbs while waiting to go under like you might be with benzodiazepines. IV sedatives also completely eliminate your ability to feel pain, but aside from that, don't affect your body in any other way, so you're still free to breathe normally and move about as you wish. While it's possible you could experience some negative side effects, your dentist should be keeping an eye on your breathing and pulse to make sure nothing goes wrong. Like laughing gas and benzos, IV sedatives also give you a feeling of relaxation and peace. However, they take it one step further. IV sedatives leave users in what's known as amnesic states, where patients are unable to remember the sights, sounds, and smells of surgery, and even the doctor's office itself. So not only will you not feel the pain, you won't even remember it. Although this is nice from a pain-killing perspective, it can be a bit scary for some. Also, dazed and confused is not generally an ideal state for motor vehicle operations, so again, you'll have to either take a Lyft or Uber or cab or get a friend to drive you to and from the dental office. So while there are some safe pain-killing alternatives to laughing gas out there, they require you to be comfortable with either popping pills or putting needles in your veins, which A, sounds kind of intense, and B, not all people are. They also both need you to have some kind of personal driver or courier to get you to and from the appointment, which can be expensive if you go the cab route and difficult to arrange if you ask friends or family. Meanwhile, all laughing gas asks of you is that you're able to breathe, are comfortable with wearing a mask over your nose for a bit, and are willing to have some giggles and good times while your dentist pokes around in your mouth for half an hour. Seriously, what's not to love? Laughing gas has been a boon to dental surgery for centuries now, and although we can make it without it, it is still far and away the best option for anesthetics available, at least in dental work. It's euphoric, relaxing, and although it can't eradicate pain on its own, it'll try its darndest to take your mind off of it. And even still, once it's paired with a general anesthetic, you'll be 110% pain-free, baby. So if you've got some dental work coming up and you're feeling a little stressed out or nervous about it, don't be afraid. Just ask your dentist for a little little laughing gas. Once you throw that mask on and take a couple deep breaths, you'll go from facing a painful surgery to giggling the procedure away. After all, we could all use a few more laughs, right, Brainyard? So if you enjoyed this video, make sure to like and subscribe by hitting the red button and thumbs up that button below. Then head on over to the Brainiac YouTube channel for even more informational videos and giggles. See you later, Brainiacs.